everybody. Welcome back to another episode of the STC Podcast called Interpreting in Healthcare, brought to you by the National Council on Interpreting in Healthcare. And I'm really excited to have a very special guest today, a former NCIHC president, and someone whose bio is going to take a second for me to get through. So, welcome, Rosanna Balistreri. And let's tell folks a little bit about you. Miss Balistreri is a diversity influencer who has dedicated most of her professional and academic experience to promoting health equity and to raising cultural awareness in healthcare. After living in Argentina, England, Spain, and Italy, where she worked as a translator and an instructor of English and French as foreign languages, she moved to California, where she has been living ever since. Over the last 2 decades, her academic background in general and applied linguistics has intersected with her passion for health equity. She holds a certificate from Harvard University on improving global health, focusing on quality and safety. She's undergone extensive training in healthcare interpreting, health equity, diversity, equity, and inclusion strategies, leadership skills, cultural awareness, and cross-cultural communication, and much more. She's served in leadership roles on national organizations and state organizations, such as President of the California Healthcare Interpreting Association, Board Director from 2005 to 2014, and President from 2010 to 2012. In 2022, she completed her term as president of the National Council on Interpreting in Healthcare, where she previously served as chair of the Standards and Training Committee and co-chair of the Languages of Limited Diffusion Workgroup. As an educator, Rosanna has collaborated with several academic and educational organizations in the development of curriculum material related to health equity, cultural diversity, cross-cultural communication, translation, and interpreting. She's a licensed trainer of the Community Interpreter, the international edition training developed by Cross-Cultural Communications, LLC, and a licensed trainer of the Applied Suicide Intervention Skills Training, ASSIST, a world-renowned training developed by Living Works that aims to teach individuals in the community to provide immediate safety to a person at risk of suicide across languages and cultures. Recently, her training has focused on trauma-informed interpreting as a way to empower victims of crime in their journey of healing. In 2008, Rosanna started her teaching role at Cal State University Fullerton in the Healthcare Interpreting Certificate Program, where she also served as a member of the Translation and Interpreting Education Advisory Board. In 2019, she transitioned to teaching community interpreting and healthcare interpreting at Cal State San Marcos University. After dedicating years in language access program implementation and management for Adventist Health, Prime Health, UC Irvine Health, and Palomar Health, in 2010, Rosanna founded Reaching Diversity to support clients across states meet the diversity needs in healthcare and mental health. Her primary goal behind Reach services is to enhance quality of health care in an equitable way, increase patient safety and compliance, and maximize customer satisfaction through effective communication and best practices of diversity, equity, inclusion, and belonging. Through Reach, she works with a spectrum of clients in assessing healthcare interpreters and bilingual clinical staff and providing quality training to healthcare interpreters and healthcare professionals. Rosanna is a dynamic member in the health equity arena and an active conference speaker and presenter on the importance of language access and cultural responsiveness. She served as a keynote speaker, panelist, and presenter at more conferences, summits, and educational events than we could count. For example, the American Translators Association, Association of Translators and Interpreters in the San Diego area, the National Council of Interpreters in Healthcare, International Medical Interpreter Association, the California Healthcare Interpreting Association, Arizona Translators and Interpreter Association, Tennessee Association of Professional Interpreters and Translators, and Texas Association of Healthcare Interpreters and Translators. Over the last 2 decades, Rosanna has partnered with numerous clients to include LA Healthcare Plan, San Diego County of Health and Human Services, California Health Workforce Initiative, University of Vermont Medical Center, MUSC Health, Grossmont Cuyamaca College, Cal State Fullerton University, San Diego Refugee Forum, Council of Community Clinics, San Diego County of Mental Health, Connecticut Area Health Education Center, Eastern AHEC Inc., Language Line Services, Links Interpreting, UCSD, Rocket Fuel Inc., Health Literacy San Diego, Stratus Video, Cope Health Solutions, Community Health Improvement Partners, Asian Pacific Counseling and Treatment Centers, ACE Translations, Palomar Health, Adventist Health, Prime Healthcare, Sharp Health, San Leandro Department of Health and Human Services, Champions for Health, Regions Health, Houston Eye Medical, Human Quality Outsourcing Personnel, IUDA, The Work Loop, San Marcos State University, AMN Health, Virginia Department of Behavioral Health and Developmental Services, Asha Kiran, African Communities Together, and many more. So welcome, Rosanna. I am so impressed, as should be everyone else. And as I said to you when we first met, I will do my best to carry the baton that you have passed on to subsequent presidents of the National Council and really try to expand our alliances with other people that work in language access, not limit ourselves to interpreters and translators, but strengthen those bonds with healthcare providers, with city services, with schools. There's just so many places where healthcare and behavioral health impact other areas of our daily life that all of us need to get on board this train and work together. So thank you so much for agreeing to be on our podcast. And let's jump straight in and ask you, looking back and look at that wealth of that client list of experiences and the number of cohorts of students and interpreters that you have trained, looking back, what stands out to you as either something you're the most proud of or that was that pivotal moment? What is, amongst the thousands of experiences, some of the things that peek out and stick out to you? Share that with us.
Thank you, Eliana. Gosh, that was a long intro. Well, it is very hard to pinpoint a single moment. It's been over 2 decades of work, and it's very difficult to shrink down something into one single moment that I'm most proud of. I would say the whole 20 years that I've been in the field have given me a lot of joy. They have made me so very proud overall because of the small contributions that I've been able to make, the impact I've been able to also make on healthcare interpreting and language access in general. I have learned so much through some of the best mentors and professionals like yourself, Eliana, and so many other colleagues in the field of healthcare interpreting. I'm very proud to have gained a lot of trust within my professional network, a lot of respect by colleagues, and not only in California, but across multiple states. And I'm truly privileged and honored to have the opportunity to achieve some positions by standing my ground within the profession, and especially by challenging some of the conversations at times when sometimes people were not ready to have those conversations, or they were kind of uncomfortable. And so I have rocked the boat, so to speak, for lack of better words, when it comes to addressing certain things that needed to be addressed, that needed to be challenged, because there's always room for challenging ourselves in the field and in our profession. We shouldn't settle ever. And so that, that whole experience of really being out there and given the opportunity to have a voice and a seat at the table has made me proud overall, really.
And I really like what you said, we shouldn't settle, right? Because many of these battles, I mean, we've been fighting it over decades, and we have slowly had some progressive movement in the right direction, but we're not there, however you define there, yet. So we have to keep plugging away, regardless of what administration is in power or what local organizations, political parties, religious groups, whatever they wish to have. We still have in our heads our mission, which is language access. Language should not be the barrier to education, to healthcare, to proper judicial justice under the law, right? Language access equals language justice for me. So keeping in mind the not being willing to settle, when you look around now in the present moment, where do you think we should be putting our energies, or what sticks out to you here and now as either the most challenging or the most exciting? Or
so, speaking about not settling, I think that while it's really exciting to see how much awareness and incrementally this awareness has grown around language access, and to see a lot of the strategic roles and at the federal level, at state level, that have been put in place. It's really exciting to see this growth, this level of awareness that is happening. It's truly invigorating. It validates that all the work that many of us have done over the years to put language access at the same level of many other healthcare programs was really done right. But I'm really, truly thrilled to witness that there is this incredible movement by, again, observing these federal job openings that are related to language access and overseeing language access programs in all areas, not only in healthcare, but in social services, in the judicial system, and so on and so forth. One thing, though, that I do notice is that while language access has moved forward, the interpreting profession, I don't see that it has moved as much as I wish to see. And it is a profession whose professionalization is still limited for multiple reasons. So should I rock the boat here, Eliana? You tell me.
Let's rock.
To be honest, I think we need to be honest. We need to be honest of the fact that many interpreters are still being underpaid, paid by the minute, something that in 2024 should not be acceptable. It's not acceptable. Interpreters still face a lot of challenges. The field is still very fragmented, with some class of interpreters, such as staff interpreters, who make really decent salaries, and then other interpreters who are barely making enough to make a living. So the field is still very fragmented. All you have to do is really go on social media. There are many interpreting groups, whether it's Facebook, whether it's LinkedIn, and just read some of what the interpreters share in those groups to really stay in tune with reality. There is wishful thinking, but then there is what people really say, which, we need to be aware of that, and we need to be very honest about that. You can't sweep that reality under the rug. And so there's still a lot to be done to really grow the profession. Like I said, I have my own personal point of views in terms of some of the challenges that surround the profession. And I'm sure my colleagues have other points of view as well. And, I think that we need to sit down and have a conversation. A lot of the stakeholders need to really put their energy together to have a conversation of how do we really move that needle of professionalizing interpreters forward. How do we do that? How do we make sure that there are not pockets where interpreters are making barely enough money, but where the interpreting profession is a profession that people are really looking forward to joining because it pays well, because it provides everything that a person in any professional field is looking for: job security, financial security, the ability to pay for a mortgage, pay for your car payment, put food on the table, and more, and be completely economically and financially independent while doing something that you love and that it helps the vulnerable individuals out there who need effective communication. So again, it's really exciting to see language access moving forward. I don't think that the profession has quite moved at the same pace, and we need to talk more about that.
Yep. And this also mirrors what has been happening with spoken language interpreters, and I call them out separately from ASL interpreters. It's very similar to what happens in the world of adjunct professors. And that's a world where I have both worlds where I have experience. I either teach at a community college to prepare people who have another language already to work as interpreters, or I have worked as an interpreter myself. And those are two pools: adjunct interpreters and spoken language, adjunct professors and spoken language interpreters that have difficulty, for example, qualifying for mortgage, even if they happen to work in a language where there are abundant assignments to choose from. And I look at that and say, how can we change that? Adjunct professors, for example, don't qualify for unemployment when they may be working quarter after quarter, and then suddenly their class is canceled due to low enrollment. Spoken language interpreters, particularly the independent contractor, also does not qualify for unemployment. And we've seen hospitals from coast to coast get rid of entire interpreting departments since COVID. So that's worrisome. But then when I look over to ASL interpreters and I see how well organized the deaf community is, as well as the ASL interpreters, I think, do we need more organization? But they also have the ADA, which supports them with a monetary penalty, whereas Title VI is somewhat toothless in that regard. So do we need different legislation? The updates to Section 1557 may give a boost to the interpreters, but at the same time, ASL interpreters all have a college degree if they are RID certified. And there is the big divide between the preparation that's required for spoken language. The minimum requirement needs to be increased. 40 hours of training can't be enough if we expect to have parity with other allied healthcare professionals. So I'm opening up a big can of worms here, saying you need a college degree.
Absolutely. And I've been
to advance your case, right? So
that has been
working together.
A strong case that I've made for the last 10 years or so. We need a standardized educational pathway for interpreting, and then the different specializations such as healthcare or legal or
behavioral health,
social service interpreting, and for behavioral health. And I agree, we look at every other allied health care professional, and there is a pathway, even if it stays at community college level, a 2-year program, that is fine. But there is a pathway and it's standardized in most of the states. We need something similar. So, I mean, that's one piece of it. I think there's a lot more to that also. But it is definitely a huge part of it is it's about perception. It's about perception. I've been there, and I know that those of you who are interpreters who are looking at, who are listening to this podcast, you probably can relate because it's happened, I'm sure, to you, where some who is a professional in healthcare in some shape or form, whether it's a nurse or a dietitian, a social worker, they ask you, so what does it take to be an interpreter? And when they hear 40 hours, what does happen? All it takes is just that number for somebody's mind to make a decision about how professional you are. So we need to do better. We need to do better.
Now, the exciting thing is 20 years ago was about when Bridging the Gap was born, right? Before that, there was nothing. And if you look now on the internet and see just how many training programs there are, it really is an enriched environment compared to what it used to be. So it's really possible. It's really possible to make these changes, which would then support greater earnings capability. But we'll have to see how we can push that through and how we can get buy-in from the people that it will support. Because education isn't cheap either, right? So how do we create some scholarships or what can we do? Go ahead.
But we also need data, and that's one thing that we're missing. And in fact, if there is anything that I can, if I can give a wishful thought here to kind of implement, complement what we've said in this podcast, is, when I look at, for example, health information technology in healthcare, right? There was a boom in HIT, and HIT grew because of financial incentives. And those financial incentives came from the largest payers in the US, which is Medicare and Medicaid. They created incentives for doctors to adopt electronic health records and ensure that they were using them in a certain way. And when I think about that, I think, well, this should also be happening for language access. We need financial incentives for language access. If there was, a recognition of the fact that miscommunication is a challenge that many systems face around cost and quality of care, why isn't interpreting being seen as an important tool to invest on as a priority? And so, but we also need data. We need more studies that really link the use of qualified interpreters or just the implementation of language access done in the right way and how it relates to cost, efficiency, quality, evidence to bring back to those who can make those financial incentives happen. Because data is what drives most of the time these decisions. And without data, it's very difficult to reach those goals. So
right. And the decision makers want numbers, not anecdotal stories about experiences, of which interpreters have so much of the thing they don't want. They want the numbers. They don't want the feelings.
They don't want opinions. They don't want opinions, right? They want facts. And we should give them the facts. I mean, there is so much in the country that is already been solid for years, and some in many organizations, whether it's health plans, whether it's clinics, whether it's hospitals. There, again, it may not be the field is not leveled across all states, but there is a lot that we can draw from in terms of really measuring. Those metrics are so important, and if we could tie those into the quality of all the different domains of quality in healthcare, I think then we would have a winner. Then it would be easier to justify why is it that language access deserves to have financial incentives and be promoted with just creating those incentives for doctors, for health plans, for anyone to really utilize interpreters as much as possible. The more you adopt them, the more reimbursement you get. I mean, right now we do have only 13 states, right, that receive some level of reimbursement through Medicaid, but we could go above and beyond that. I'm talking about something completely radical, something completely different, that something new, right?
So if we're talking about something new, let's look ahead.
Yeah.
What do you see? What would you like to see? What do you fear seeing? Any of those? Looking ahead, what needs to happen, Rosanna?
Well, like I said, we need more data. We need more research. We need to really link utilization of interpreting services. There's already a lot of information out there, but it's all disconnected. If you look out there, there's research that talks about, length of a visit based on modality of interpreting, whether it's video remote interpreting versus over the phone versus in person, and the length of that visit. There is other research that focuses on other things. We need to have a research that really compares the data so that it can really analyze how interpreting services, how an effective language access program really impact cost. How does it impact efficiency of services? How does it impact quality of care that is being provided? Again, if we explore all the domains of quality, and we could really dissect each one and make it a connection to language access, and then bring all this information. And of course, I'm sure it's not going to happen overnight. This is a lot of work to be done, right? But we need to start somewhere. Otherwise, if you don't start from sites, it's just like the lottery. If you don't play the ticket, then you're never going to win. And so we need to start from somewhere. Otherwise, we're never going to get there. We're never going to reach that journey.
Maybe we need to start working on that framework of what are the questions, what is the data that we need collected, and then solicit people to contribute.
And we don't have to. Yeah, we don't have to even reinvent the wheel. Let's use the lessons from, like I said before, the health information system or technology. And how is it that health information technology grew? And it's because of those financial incentives. But why did they receive so many incentives? Because there was enough data that showed how the utilization of health information systems really impacted the quality and efficiency of care, how it made care safer, how, especially around medications. And we have that data at some levels, because I know that, by speaking informally with some administrators, they've done some root cause analysis where it shows that effective communication, or ineffective communication, I should say, is linked to issues with medications. The adherence to guidelines, the clinical practice guidelines, all those, again, we don't have to reinvent the wheel. Let's look at how a field that grew so well in healthcare that is being now adopted pretty much by almost every system,
Mhm.
was able to make it. And then let's learn the lessons from that journey and bring it to language access. I think that that's my wishful thinking, to see one day that level of evidence and the level of incentives, financial incentives, because it would be a game changer. It would be a complete game
Well, you
changer.
heard it here, folks. Start asking those questions. We all know the numbers that are currently tracked, whether it's length of stay, readmission rate, medication errors. How about improved health outcomes? There's ways to report those numbers. Let's start collecting them. Let's start sharing them, creating a database, because we need the number game to be able to speak the C-suite lingo and get the changes implemented that we need in order to support the profession, which inevitably supports limited English proficient patients and their families. It's inextricably linked. If you have language access, a well thought out language access program, and interpreters and translators working in your system, it's going to benefit everybody who participates in that system. So is
Yeah.
there anything you want to add to your message, Rosanna? Because that is really an important one. We'll send everybody out like worker bees to come back to the hive with some of that data that we need in order to build our case.
Well, maybe just an invitation for those of you who would like to continue this conversation to reach out to the National Council. And maybe we can start from there. Just let us know who you are. And maybe the National Council will be able to create a platform or a forum for to launch those conversations, and we'll see what happens. All it takes is just one small step and baby steps, right? Baby steps. Because I mean, in any other field of care, it's all been about baby steps. And so we also need to take baby steps. But maybe the National Council will provide that the grounds and the platform to start those conversations. So if you're interested, maybe reach out to the National Council. It might setting you guys up.
I welcome being set up in this regard. Everyone is welcome. All opinions are valid. Everybody will be heard, but contribute some data so that we can stop spinning our wheels and help support the maintenance as well as the expansion of language access programs within hospitals, within clinics, within schools, within communities, within the courts, within emergency responders, in the park systems, in public arenas, wherever. If there's a fire drill, we need to know that it's a fire drill and not a real fire. And we need to be able to communicate that in more than one language so that we don't have panic, right? And this is a great country built by people from all over. So we can do this. We just need to have an organized way to present our position and our asks in order to make it happen, backed up with data, right?
Absolutely. And then we have so much talent out there with our members. There's, we have members who are in so many different positions inside the organizations that they work in. And so, I hope to see that conversation comes from and draws all this talent into one place so that we can get started talking about how do we really propel this? How do we make it happen?
So, well, thanks so much for joining us today. It was a very special conversation, a very special podcast. Bookmark this one on your devices, folks, because I want you to share it with your colleagues and friends. We need to bring ourselves together as a group and be organized to make the changes that we want to see happen in our lives. And that starts with some metrics and some data points. Thank you for being with us again, Rosanna.
Thank you, Eliana. Thank you so much. My thanks to the National Council for having me. Appreciate it.
Thanks for joining us today, everybody. We'll see you at the next podcast. Ciao, ciao.